Right, I'm going to spend a few minutes talking about the how, and I'll cover the research cycle and what we're calling here some top tips. Involve have come up with what I feel is a very helpful diagram, which breaks down the research cycle, what happens in a research project, into different stages. And I think it's really helpful to look at a research project this way when we're thinking about public and patient involvement, and indeed when we are actually working on a project and involving the public and patients in it. So I'll start at the top, which is identifying and prioritising research topics. It's very important. This is often an area that gets neglected, and there isn't a great deal of public and patient involvement in this area. It is improving, I think, but actually having that public and patient perspective of identifying and prioritising what people want researching, I think it is absolutely key, and often it's the case that the research topics that the public and patient body, if you like, will identify as being really important for them is not necessarily as important for researchers or clinicians. So really important to get that input in, and you know there's ways of doing that. You can consult sort of online groups in your particular research area. You can get a local research group going and get them to have a workshop and talk about what research topics are important for them. Moving on to the commissioning. Again, really important to have some public and patient representation in the commissioning process, and I believe this is happening more and more. For me, it's about following through the identification of those research topics from the public's point of view, and making sure that whoever makes those big decisions on what gets funded and what research projects actually happen are kind of making sure that public priority, public and patient priority, is carried through in that funding process. Really important. On to the third stage of designing and managing research, and I kind of break this down into two parts really. The design phase, a lot of that will happen before the project starts. Obviously it'll happen before the application gets presented, and this is where having some public and patient involvement is really key. Again, there's lots of different ways of doing this, and I'll go on to that in a bit more detail in our top tips section. Managing the research is an important part of a research project. This can be by way of what we often call a steering group or an advisory group. Those are the terms that we use here in the UK. And having some public and patient representation on groups like that is really important. Those steering groups are responsible for making sure that the research project is carried out in the way that it's said it's going to be, and that the governance is followed and protocol. So very important to have that public and patient part that's part of that group that's deciding that. Undertaking the research, well, this is quite clear. I guess it's all about doing the research, you know, doing the interviews, doing the analysis, writing up your findings. And there's lots of different ways of getting people involved in this part of the research. In my department, for example, whenever we get a research project that's funded, we advertise for a researcher, and one of the essential attributes that we are looking for is that they have lived experience, and that means that we will appoint somebody who not only has research experience but has lived experience of the topic, so that they'll be able to actively use that in the work that they're doing. But there are other ways. In other projects that I've been involved in, we've had a group of what we've called co-researchers, and they're a group of people that perhaps don't want to work full-time, and there'll be a group of people that work together and may help the researchers to do the interviews or to write the participant information sheets, for example. Moving on to dissemination. This is often a part of the research project that maybe falls off the edge a little bit. Often when it comes around to disseminating your findings of your research, the funding's run out, the project's actually finished, and people have moved on to another project. And it is actually quite a challenge to involve members of the public in this area, but very important to do so. And a way I've found in my work that helps is not to wait until the project's over before you present your results, but to perhaps try and attend a conference with your public and patient representatives while the research is ongoing, so that you can explain to your audience not only about the research, but about the public and patient involvement in that. And obviously, you would involve members of the public and patient doing that. Implementation. Obviously, research is not really any point doing research if your report just ends up on an office shelf, and maybe the best that happens with that is that it gets read. Research for me is all about implementing the findings of your research. So actually translating what you found out in your research to real life, really, and services that are ongoing. And again, having public and patient involvement in this element is key in terms of making sure that what the research has found out actually happens in real life. So you could have a group of local people who are working with staff, say, in a particular area, and say, look, we've done this research, we've found out that this is particularly helpful. How can we work with you to perhaps put something together to introduce that into your treatment or the kind of service that you're offering? And finally, evaluating impact. This is quite an important area of public and patient involvement. It's very important to produce evidence that public and patient involvement works. We know it does. There's lots of evidence out there. Often this evaluation, though, happens after the research project has finished, and it's retrospective, and people look back. And in my experience, I found it's much more useful to make this evaluation of the public and patient involvement as some kind of continuous reflection throughout the research project and process. Right, I'm now going to move on to some what we're calling top tips, and these are really sort of guidance and things that it would be really helpful for you to think about if you're researchers or hoping to get involved, or developing or encouraging public and patient involvement in your research. Involvement as early as possible. I can appreciate that it's sometimes not possible to perhaps get involvement in all those different stages of the research cycle, but it's certainly true that the earlier you involve people, I think the better your research will be from a public and patient involvement point of view. The more engaged it will be and the more in-depth the involvement will be. So, for instance, establishing and maintaining a public and patient and public reference group. We have one at St George's that we set up in 2010. It's got about 15 local service users and carers. They're all interested in taking an active part, becoming actively involved in research. And we meet every 2 or 3 months. And the beauty of a local reference group like that, that's not connected to a particular project, is that you've got some continuity there. You build up some experience. Our members have been involved in lots and lots of different research projects. They get consulted at the initial stages. We have workshops and brainstorming sessions to set priorities. They work very actively on a research proposal, and some of them then go on to get involved in the research proposal itself if it gets funded. So that's what we found to be a really great way of ensuring some consistency in the involvement. Also, obviously important to establish relationships with patient groups and charities, be that locally or nationally. Finding patients and public, well, there's lots of different resources to do this. For instance, the People in Research website will help you with this. Another network is the Clinical Research Network. Asking community members in your area is very helpful. Advertising in GP surgeries, outpatient departments, local newspapers, the radio, etc. Again, very important. Talking to local or national patient support groups and voluntary organisations. Searching online for relevant organisations that can help in terms of making initial contacts and finding out about new organisations. I've worked in the field for about 15 years and I'm still finding out about new organisations, and new organisations crop up all the time. It's quite a fast moving area. So, you know, the contacts that you might have made a couple of years ago, it's always a good idea to kind of keep those updated so that you're well on top of things. Online social media such as Facebook or Twitter is really useful, and talking to other health and social care professionals in your area as well. Another top tip around accessibility, and it's really important to try and get this right. One of the main challenges that people tell us stops them from getting involved in a meaningful way is accessibility. And I see it as you know, the research environment that we're all very used to, either in a hospital or an academic institution, can be very alien to members of the public and patients. And so it's a case of really not, you know, being very sensitive if we're inviting people from outside of those environments into our environments. And better still, it's about meeting people in their environments as well. So for instance, you know, I think we're all guilty of using research jargon and acronyms, those of us who work in research. So it's really important to make language very clear and accessible. That doesn't mean to say that we necessarily have to simplify everything, but we just have to get rid of that jargon. You may have to, for instance, have meetings in the evenings or at the weekends. You would have to consider distance, whether people can travel to you or whether it's best for you to travel to other people. And obviously, if people have disabilities or if they have carer needs or childcare needs or any areas around disability, it's obviously essential that you consider those. Very important also to make sure that you're well equipped with your resources before you start, so that you've done your necessary homework around making sure that you've got a clear payment policy, that you know what expenses you can and can't cover, that you're building all of those resources into your research proposal so that you've got adequate funding for it. I can't stress how important this is to do, and how helpful it is to think about these things in advance. Training support, another really important area. I seem to be saying it's really important, all these areas are important, but they certainly are. It's often the case that people who you'll get involved in research won't necessarily have a lot of research knowledge or expertise. Some will, but some won't. So you'll need to factor in the time and the resources needed to make sure that people are fully knowledgeable and informed about what they're doing. It's always good to have more than one patient and public representative, and it's always good to have a nominated person in the research team as a contact, and also to have regular continuous feedback so that you can adjust the way you're involving your team if you need to. And obviously acknowledgement is essential. Just a little bit about hierarchies of knowledge, actually, and I think there are a lot of divisions in this, and the fact that we respect sort of the hierarchy of knowledge in terms of the research institutions, and I think public and patient involvement is very good at challenging this and opening people's eyes to the fact that there's more than one kind of knowledge. Knowledge comes from different perspectives, and we shouldn't just consider the knowledge that a researcher has as being top of the tree. The knowledge and expertise and perspective that a member of the public or a patient has could be just as valuable. So it's really good to keep that in mind. I'm aware of time, so I'm just going to very briefly go through the last slide, which is about managing expectations. Key to successful involvement is just being very clear with people about where you're doing the research, what you're doing it on, what kind of organisation you're asking people to work within, the kind of experience that you're asking people for to bring into the work, what they'll be doing, how long they'll be spending on it, how much you're going to pay them, what expenses you'll cover, what support and training you can offer, and how much influence they will have. If people have a very clear idea of what they can and can't influence in research, that is often a key to successful involvement. I'll now hand back over to Gary to sum up this part of the presentation. Thank you.
So just going to briefly sum up then. So we've covered the what is patient and public involvement question. We distinguish between involvement, participation and engagement, and we talked about different approaches to patient and public involvement, such as consultation, collaboration and patient-controlled or patient-led research, and how the concept of power is important in distinguishing between those different approaches. We talked about why patient and public involvement is important, why you should do it. We talked about the different perspectives that patient and publics bring to a research project, how they can improve the research quality, the research relevance. We talked about the moral imperative, about patients having a right to be involved in decisions and research that impact upon them. And we talked about, of course, patient and public involvement in research increasingly becoming the norm, becoming the standard in good research. And then finally, Katie talked about how we do patient and public involvement. She talked about how you can involve patient and public in all stages of the research cycle. And then we went through top tips of things for you to consider in your research about involving the patient and public as early as possible, about accessibility in terms of both language and actually physical accessibility, about resourcing patient and public involvement, about the provision of training and support for both patients and public, and of course researchers too, about respecting the expertise of patients and public, and about the importance of managing expectations and clarifying responsibilities. So that in a nutshell is what we've covered.